I'm Dr. Sri. I'm a board certified family medicine and sports medicine doctor, practice in the United States, Kentucky. So recently, I saw a patient who has type 2 diabetes and he also had high cholesterol. So basically, he came with an average blood sugar level of around 200 milligram per deciliter and his LDL cholesterol, which we also call as a bad cholesterol, was around 150s. So the one biggest thing that I liked about this individual was that he was a very motivated person. And he basically was asking my advice that he could start to implement right away so that he can get his diabetes as well as high cholesterol better. The biggest lifestyle change that I made him do was to focus predominantly on whole plant-based foods. So for example, he replaced this morning quick oats recipe that comes with in a packet with added sugar. He replaced that with steel-cut oats with fruits. He started avoiding all fried items. He started cutting back on his sugar intake. He started paying attention to the added sugar in the packaged foods, and thereby he was able to cut back on his sugar intake. In addition to that, he was eating 5 to 7 servings of fruits and vegetables in his diet. And again, we're not focusing on just one vegetable. He was having a lot of variety of vegetables, including like Brussels sprouts, cabbage, broccoli, eggplant, lettuce, cucumber, and so forth. And same way with his fruits, he was having he was including a lot of diverse groups of fruits in his diet, like pineapple, apple, mango, things like that. His 2000 calorie diet looked like this. Morning, 1 cup of steel-cut oats with fruits. Snack, fruits with cucumber and red pepper. Lunch, lentil curry with quinoa and baked broccoli and cauliflower. Snack, nuts with a protein shake. Dinner, tofu salad with peanut dressing. His calories were almost similar previously, but his fiber intake went up from 15 gram per day to almost 40 to 50 gram per day. He started feeling full and his appetite began to regulate better. So I saw him back after 6 months. And his A1C, which is the average blood sugar that we test for diabetes, it was completely reversed. His A1C was normal. His LDL cholesterol dropped to almost 80s, and he lost 10% of body weight. Now the biggest question is that, did the whole plant-based foods made those improvements in his labs, or was it just a weight loss? But again, there is always a debate that goes between whether the weight loss matters or how one achieve weight loss matters is a big debate. But I've also seen that some people have lost a lot of weight from following more like an animal-based diet. But the problem is that even though they have lost weight, there are some people who have increased their cholesterol by following animal-based diet. For some people, it didn't matter much. But I'm yet to see a lot of negative effects from people who adopt more whole plant-based food approach in order to improve their health. So there was even a recent study that compared the keto diet with the Mediterranean diet. So it also discussed about the similar issues that I see in my clinical practice. The keto diet led to a greater decrease in triglycerides, but also had potential risk due to elevated LDL cholesterol, and there were concerns about lower nutrient intakes from avoiding legumes, fruits, and whole intact grains, as well as being less sustainable. So there's a high chance that the dietary fiber that he was consuming in his eating habits probably led to those positive changes and would have benefited his blood work as well as helping him lose weight. So in this video, we're going to talk about what is dietary fiber. So this way, once you understand it, you can start implementing that in your lifestyle as well so that you can be benefited like my patient did. So the dietary fiber refers to edible plant parts that are resistant to digestion and absorption in the small intestine, but can be fermented partially or entirely in the colon. So under dietary fiber, we encounter fibers with different degrees of polymerization. So think about how complicated the structure is. Let's say the higher the polymerization is, it means it's harder to break down. So examples of fibers that have a high degree of polymerization includes the outer layer of pulses, oat bran, wheat bran, and the cell walls of vegetables and fruits. So there are two forms of dietary fiber. So we have the soluble fiber and then we have the insoluble fiber. Soluble fiber, as the name implies, they can be dissolved in water and then they form a colloidal solution in the intestine when we ingest it, and thereby it slows down the digestion. And when it slows down the digestion, it means that the absorption of nutrients is not as quick. So examples of some of the richest source of soluble fibers include apples, pears, citrus fruits, carrots, broccoli, peas, cucumbers, celery, and oat bran. So let me give you an example how soluble fiber can help. So let us say if I want to enjoy a piece of chocolate. So if I have a meal with a high fiber intake, that high fiber forms a colloidal solution in the intestine. So then now I eat a piece of chocolate, it is going to have a slower absorption and thereby causing the release of sugar slowly in the bloodstream compared to when you have a chocolate without a high fiber meal. So let's say, for example, you eat a chocolate without a high fiber meal, that chocolate is going to get absorbed faster and thereby causing the blood sugar spike, and thereby causing the insulin spike. And when the insulin spikes happens, and let us say if someone does this pretty much every day, then this can increase risk for insulin resistance and thereby increase risk for type 2 diabetes, weight gain, and so forth. Now let us talk about insoluble fiber. As the name implies, they pass intact into your digestive system and they accelerate the intestinal transit time, and thereby they play a role in the detoxification process. So by increasing the stool bulk and speeding up the intestinal transit time, insoluble fibers help prevent the stool from becoming hard and difficult to pass. This can reduce the risk of constipation and associated discomfort. It's also important to understand that the faster intestinal transit time helps to make sure that the toxic substances in the stool spend less time in the colon and thereby reduce the risk of colon-related disorders. And there are some studies that shows that high dietary fiber intake can decrease the risk for colon cancer. So the insoluble dietary fibers include lignin, hemicellulose, chitin, resistant starch, and resistant dextrin. Nuts, beans, whole wheat, barley, and roots are the best sources of insoluble dietary fiber. So fresh fruits and vegetables, they provide less fiber per fresh weight, but when considering fiber content per calorie, they provide more fiber. Grains and legumes, they provide more fiber per weight. So as you can see, these dietary fibers, they're neither digested nor they're absorbed. If that is the case, how do the fiber provide us benefits? So imagine the gut as an ocean of bacteria, a complex ecosystem. We're beginning to understand more, especially its association with diseases. So there is still much we don't know. I feel like we're just only seeing the tip of the iceberg right now. Research indicates that there are changes in gut profile that have associations with certain diseases. For example, so let us say if someone is suffering from obesity, they have a different gut microbial profile compared to the one who does not have any weight issues. So animal studies have demonstrated that fecal transplant from lean to obese mice can help restore metabolism, and the reverse transfer produces similar results in the context of obesity. This principle also applies to conditions like diabetes and autoimmune diseases as well. So we use this concept in our clinical practice currently. So for example, there is an infection called as the Clostridium difficile colitis. So basically it is an overgrowth of this bacteria called as a Clostridium difficile that can cause colonic inflammation. So basically inflammation of the colon, which can be life-threatening. We use antibiotics to kill the overgrowth of this bacteria, but sometimes it keeps coming back again and again. So in those cases, a transplant from a healthy donor, a transplant of feces, so basically the fecal transplant, where a feces from a healthy donor is taken and then implemented into the individual who is suffering from the C. diff colitis, and thereby this helps to treat this condition. So the biggest problem is that we're still unclear whether obesity, autoimmune diseases, or diabetes originate from poor gut health initially or are the consequences of lifestyle choices. In some cases, it might seem like lifestyle choices play a significant role, but genetics cannot be ruled out, making it challenging to establish a direct cause. So think about this. In my clinical practice, I have patients who follow unhealthy lifestyle. They smoke, they may not be eating healthy, and they still don't develop diabetes, obesity, autoimmune diseases, and so forth. Whereas there's a subset of patients who might be following unhealthy lifestyle and develop diabetes, autoimmune diseases, obesity, and so forth. There's also a subset of patients who actually follow a pretty healthy lifestyle and still develop autoimmune diseases like type 1 diabetes or Crohn's disease, things like that. So obviously we blame it on the genetics, but there is also a chance that maybe it is because of the gut microbial profile. So for example, the theory is that the person who is developing diabetes, obesity, or autoimmune diseases, they might have a poor gut microbial profile to begin with, and thereby decrease the predisposition for them to develop autoimmune diseases or chronic diseases. Whereas the other person who is still engaging in unhealthy lifestyle, they might be protected by their gut microbial profile. But again, there's always a chance that if this person continues with this unhealthy lifestyle, their offsprings might be affected as well. So again, as you can see, there are so many questions that are not answered, which is why I said we are only looking at the tip of the iceberg. So if you see someone in social media or someone is so confident that they have got all the information that you need about gut health and stuff, please proceed with caution. So far we have talked a lot about gut microbial profile. So what does fiber have to do with this? So imagine that you have a garden at home with both weeds and growing plants. Depending on what you feed your garden, you can decide whether there'll be too many weeds or too many plants. Obviously, you want plants to grow in your garden. Similarly, you want friendly bacteria, virus, and fungi in your gut that help your body. So the fiber from plants is like a good manure for good gut microbes. So let us say, for example, there is a bacteria, which is a good bacteria called as the bifidobacterium, and they help your body. And let us say they're low in number. So now you started to decide, you know what, I'm going to eat a lot of vegetables. And let's say, for example, I ate asparagus this afternoon. So the inulin fiber in the asparagus is actually the food for this bifidobacterium. So what the bifidobacterium does is that it's going to consume that inulin and is going to produce a byproduct called as a short-chain fatty acid. And this short-chain fatty acid has the capability to communicate with your gut and regulate your appetite. So what's going to do? It's going to help with your weight. It's going to help to regulate your weight. Now these short-chain fatty acids also help to heal your intestinal lining, and thereby your lining is going to be strong, thereby the toxins are not going to enter. So this way, the short-chain fatty acid is going to help with the colon cancer. The short-chain fatty acids could also be a food for another good bacterium. So basically, like, the byproduct of one bacteria can be a food for another bacteria, and thereby think about this ocean of bacteria where the good bacteria kind of proliferates and then the bad bacteria kind of like goes down. And this way, it's going to help your health. In addition to growing this good bacteria, we also have talked about how this fiber speeds up the intestinal motility and thereby decrease the exposure of toxic substances that come into contact with your colon. So now when we apply these concepts to my patient who actually was able to reverse his type 2 diabetes, so think about this, like, the amount of fiber that he was having, it was able to regulate his appetite. It was decreasing his blood sugar spikes, and thereby his A1C got better. Because his appetite was regulated better, he was able to lose his weight as well. So what about cholesterol? His bad cholesterol, the LDL cholesterol, dropped to 80s. How is that possible? So basically, your cholesterol is excreted via bile acids into the colon. The cholesterol is usually reabsorbed. But because there is so much amount of fiber in your gut, that fiber helps prevent reabsorption of the cholesterol, and thereby the liver upregulates your cholesterol receptor. So basically the liver says, like, you know what, I want all the cholesterol back. So the cholesterol all goes back to the liver, and thereby that decreases the amount of circulating cholesterol in the bloodstream. So now that you know why fiber is so important, let's explore some practical ways. And I'm going to use my patient as an example, how he was able to do it. So this way you can start to increase your dietary fiber intake as well. So for breakfast, he opted for steel cut oats. So this provided him with 4 grams of fiber. In comparison, a commonly eaten breakfast cereal like cornflakes, which in a cup contains 101 calories and a high amount of sodium, around 11% of the recommended daily intake. The cornflakes have 24 grams of carbohydrates, consisting of 1 gram of dietary fiber and 2 grams of sugar. Additionally, as you can see, he included 1 cup of berries, contributing to almost 7 to 8 grams of fiber. So altogether for breakfast alone, his intake was approximately 10 to 12 grams of dietary fiber. So as a South Indian myself, I want to provide a good tip for my South Indian audience, where their primary breakfast staple is idli with sambar. So basically, idli is a rice cake and sambar is almost like a lentil soup. And if you're not a South Indian, I would highly recommend to try this. Food. It's not only delicious, but as we'll talk about, this one also has a lot of dietary fiber as well. So according to the USDA, one idli is a low-calorie food providing almost 49 calories of energy. It is a suitable source of dietary fiber, offering 2.2 grams per 9.5 grams of carbohydrates. Idli, which is basically the rice cake, it requires no oil and is steamed and is low in fat and is a considerable source of protein. Now let us say you pair the idli with sambar, so basically the lentil soup. That lentil soup is going to have a lot of dietary fiber, so basically you're getting almost like 10 grams of fiber in that meal. But here's the catch. So one can make, so just because I say idli is a good food, it also depends on how one makes idli as well. So for example, let us say one chooses more of a processed white rice instead of a little bit more like a brown rice. Or let us say if someone chooses more like a hulled urad dal instead of the whole on skin urad dal, that's going to decrease the dietary fiber content as well. And this is just to show an example. Sometimes it is not just the. Sometimes I wouldn't call one thing as good or bad. It also depends on how one cooks that particular food as well. So for snacks, my patient had fruits and cucumber, easily adding another 7 to 10 grams of dietary fiber. For lunch, he consumed legumes with vegetables, and we know that legumes and vegetables, they both contain a lot of fiber, adding another 10 to 15 grams of fiber. He snacked on nuts, contributing to an additional 5 to 7 grams of dietary fiber. For dinner, a salad with a lot of vegetables along with tofu, another good source of protein, provided with around 7 to 10 grams of dietary fiber. You have a lot of options to make sure that you increase your dietary fiber intake. For example, like one can have sweet potato with eggs for breakfast and increase the dietary fiber through sweet potato. So one can consume a good amount of a soup for the dinner and increase the fiber intake. So what I'm going to do is I'm going to attach the fiber chart in the description box below. I would recommend you to look at the fiber chart, get an idea of what the dietary fiber that each food contains, and so that this way you can plan your meals accordingly. So the recommendation for dietary fiber intake is almost like 30 to 40 grams, and my patient was consuming almost like 50 grams of dietary fiber. No wonder he was able to lose weight, reverse his diabetes, and he was able to get his cholesterol under control as well. So now that you know that how fiber intake helps you, I want to reflect on your daily diet and see how you're doing with it. So for example, like let us say if you're someone who do not eat any fiber at all, in that case, I would recommend to start slowly and gradually progress. For some people, they might be sensitive. So they might be sensitive because the fiber starts to pull more water into the intestine and thereby cause more abdominal discomfort. So if that is the case, that's why I recommend to start slowly and gradually progress. There are some conditions where, for example, like irritable bowel syndrome or conditions that have colonic inflammation like inflammatory bowel disease and so forth, people may not be able to handle fiber. If that is the case, I recommend to discuss with a health doctor and see how you can start to incorporate more fiber in your diet. So if you're suffering from type 2 diabetes and you want to understand how fiber intake can help to cut back on your blood sugar spikes like we discussed, but if you want to know more about it, I would highly recommend to understand the concept of glycemic index and glycemic load. If you want to know more about glycemic index and glycemic load, then check out this video here. If you're someone that you want to start to increase the intake of dietary carbohydrates, but at the same time you want to make sure that you don't want to cause damage to your metabolism, you want to make sure that you choose the right source of carbohydrates, then check out this video here. And if you really enjoyed this video, if you found this video helpful, please make sure that hit the like button and share this video with others so that others can be benefited as well. And I'll see you in my next video. Until then, goodbye.